Around 10 p.m. on April 23, the oxygen tank at Jaipur Golden Hospital in India was almost empty, and the airflow to the ventilator stopped due to a decrease in oxygen pressure. In just a few hours, 26 patients died. Rabinder Kumar has been working at the Jaipur Golden Hospital for almost 30 years. Throughout the day on April 23, he and his staff made every effort to call all the places where oxygen was needed, from hospitals, police stations, and government officials. A 55-year-old senior manager said, "It's like the whole city is looking for oxygen. I've never felt so helpless in my life." Jaipur Golden Hospital started struggling last week when medical oxygen distributors said their supply was cut off due to a surge in demand, Kumar said. On April 23, at 1 p.m., Kumar tried to call a senior city health official. It was clear that people would die if oxygen didn't come out sooner, Kumar reported in an urgent hospital situation. That evening, coronavirus patients died one after another in the intensive care unit. A few hours later, with the help of police and officials, a nearby government-controlled hospital moved the stored oxygen to Jaipur Golden. The process of pumping air into the tank and maintaining the desired pressure took extra time. The amount of freshly transferred oxygen was not enough to last half a day. After many patients died, Kumar said, "I am not sure if we will be able to avoid the same situation again." The incident portrayed India's terrible war on the coronavirus, alongside India's second devastating coronavirus pandemic. India reported more than 6,800 new cases of coronavirus infection on April 26, and reported a record number of new coronavirus infections for the third consecutive day. More than 195,000 people have died to date, but analysts say government data is not enough to reflect the real situation. Experts believe the impact of the virus mutation, people's behavior, and government subjectivity are the three main causes of the coronavirus pandemic in India. The number of coronavirus infections increased dramatically, causing hospitals to fail to treat Wanderung. And the country was uneasy. Coronavirus patients are denied hospitalization due to lack of beds. As the number of deaths from the coronavirus increases, the city's crematorium operates day and night. Demand for medical oxygen has skyrocketed, especially in Delhi, the country's largest epidemic region. For days, officials and hospitals have warned that the supply of oxygen is dangerously low. Some medical institutions have announced that they will stop accepting patients due to the scarcity of oxygen. The hospital called on social media for help, saying the disaster would come within hours. Indian officials say they are coordinating trains and aircraft carrying medical supplies for areas severely affected by the coronavirus. Many countries such as the United States, France, United Kingdom, Germany and Singapore also send oxygen production and storage equipment to India. In a speech last week, Indian Prime Minister Narendra Modi said the second coronavirus pandemic was a storm. The Indian government has mobilized all its resources to increase oxygen supply. But the crisis continued. On April 24, Delhi's Prime Minister Arvind Kejriwal asked for oxygen to be supplied to Delhi, if any other state had spare oxygen. Late the same day, Sir Gangaram Hospital, one of the city's largest private hospitals, made a fourth emergency call, saying that there was not enough oxygen left for 24 hours. According to a hospital spokesman, oxygen was depleted, and emergency bells installed on the speaker's bed rang from many ventilators, and the medical staff had to pump air manually. On April 23, 25 patients died in the same hospital. Other healthcare facilities in Delhi have said that oxygen sources will arrive as soon as stock runs out, but it can only last for a few hours. Bartra Hospital, which has more than 300 coronavirus patients who need ventilators, received 1,500 liters of fresh liquid oxygen for about 6 hours, around 5 p.m. on April 24. What happened after that? The hospital director said, "Only God knows." Many hospitals desperately demanded the Delhi Supreme Court to secure oxygen supplies from officials. "This is a serious crisis," said Sachin Datta, a lawyer representing Jaipur Golden Hospital. For the relatives of the dead, a series of painful and angry days continued. Atul Kapur, a 40-year-old businessman, was treated at the ICU hospital and showed signs of improvement. When the media reported last week's chaos in the medical facility, his family rushed to the hospital. But Kapur is dead. Kapur's brother-in-law Aman Josh Kapur didn't die because of the coronavirus, he was killed. "He's completely collapsed, as if he were no one running the country," said. The people of India are falling into despair.